Psychedelic medicines in general create an opportunity for self-awareness, for self-compassion, to learn about oneself so that we can choose differently and design a life that's in line with who we truly are.
I worked previously in a trauma and neurosurgery department in downtown Toronto. I saw a lot of clients who attempted to commit suicide, and they were even on traditional therapies such as antidepressants and therapy. And I often found that even though we would help them, treat them, they would come back with repeated suicide attempts. So I noticed that for some, antidepressants may work, but for others, not always. And I really wanted to find something that was going to help people that were searching for alternative therapies.
I think the psilocybin trials that have been run by people like Roland Griffiths and Johns Hopkins, or David Nutt and Robin Carhart-Harris and others in the UK are really seminal, because they pushed against significant opposition for many, many years, and despite that, or perhaps because of it, they've been able to show fairly robust findings. So I admire the fact that we now have impressive data from individuals at Hopkins and Imperial College and other centres in the UK.
The combination of ketamine and therapy together is extremely synergistic, and what we're hoping to do is, through 5 or 6 sessions of this drug plus therapy, do what would take maybe months or even years with just therapy alone. So we're supercharging therapy by using ketamine to open the mind, to go deeper, faster, and quicker, to alleviate substantial suffering such as suicidality or severe depression very quickly.
Ketamine is the poster child for a paradigm shift in how we think about treating depression. It's been looked at for well over 20 years in terms of treating psychiatric disorders. People focused a lot on serotonin, norepinephrine. We have the Prozac generation and drugs before and after where that was part of the mechanism, and yet about 1/3 of our patients didn't respond. So ketamine comes along, but it works through different transmitter systems in the brain, and it seems to work much more rapidly than the traditional treatments.
Before clients come in for their ketamine-assisted psychotherapy sessions, we do a psychological assessment to assess their readiness for our treatment program.
Field Trip is actually taking a bold step in terms of looking at the combination of psychotherapy with ketamine. We also know that there's a history of psychotherapy and people being more open to change with generally low doses of mind-altering substances, ketamine being a mild psychedelic, if you like. So I think it is, and there's limited but a fairly good evidence base that the combination works.
We want patients when they walk in to feel relaxed, calm, and we actually want to encourage them to feel like they've entered a different space. And that kind of sets the tone for the ketamine therapy, because the ketamine is going to push them into a different mind space. We strongly believe that when you're trying to help someone with significant depression, it's extremely important not to just give the drug, which is a biomedical approach, but rather also pair that with psychotherapy, so you have the biomedical psychosocial approach, which is a much more therapeutic one.
And I think we've established over the last 2 decades that many people say, when I take a medication, I'm more enabled to make use of a psychotherapy. And I think this is an extension of that thinking. So I think there'll become a coming together of those who are in the psychotherapy world and those who are in the medication world.
So ketamine is an interesting psychedelic because the experience is different every single time. More milder levels, it can produce feelings of relaxation, reduce feelings of anxiety, create an opening really for the therapeutic work that's to follow, and what we feel is a real benefit of this program.
With respect to mental health conditions, people with a history of psychosis or schizophrenia are not good candidates for ketamine-assisted psychotherapy. Certain personality disorders also tend to show a lot of resistance to change and may not be the best candidates for ketamine-assisted psychotherapy. From the medical side, we're really just worried about people with compromised airways, such as very, very severe lung disease, very severe sleep apnea, or obesity, which can contribute to airway collapse. Other than those pockets of medical conditions and psychiatric conditions, ketamine is mostly a safe therapy. We put eye shades on their eyes to have them look inward, and we put headphones on their ears to help support the experience with synergistic music. And we have a therapist in the room the entire time. And then after that hour session or drug experience, we sit down and we try to understand what it is that came to light that produces meaning in their life. And then with integration sessions, what we try to understand is how can we take these ketamine-assisted psychotherapy experiences and integrate it into your day-to-day life so that your patterns are changing every day, your behaviors are changing every day, so that the life that you lead is more meaningful. Yeah, as this paradigm shift takes place, I envision a future where once a year or maybe twice a year, individuals with mental health illnesses will go into a clinic setting. They will have the right drug for that condition with the right therapy over a certain number of sessions, and they'll have a cure for their mental health. Whether it lasts 6 months, 12 months, 5 years, or 10 years, we don't have the answer to it. But we're not going to be taking a pill every single day to help alleviate mental suffering. And then I also see another area of just mental well-being. So many people aren't sick and they don't necessarily qualify for ketamine-assisted psychotherapy, but they're also still not living meaningful lives, or they're not well and they want to just feel better. So just because they don't have a diagnosis or a label, we might call that recreational use, but the reality is people who use these substances, they just want to feel better. So I think the future will also hold an opportunity for individuals without mental health diagnoses who just want to feel better. They will be able to use these drugs and therapies as well.
We encourage self-care following this program. This is one part of a larger journey that happens over the course of a person's life.